Hi everyone, my name is Emily Bach. I'm a women's health nurse practitioner student at Regis College. Today I'll be filming my musculoskeletal assessment for advanced health assessment. I consent to being in this video. This is my dad, Jan. Do you consent to being in this video?
Yes.
Perfect. So starting with the TMJ, I can see for him, he doesn't have any swelling. Can you open and close? So no crepitus, tenderness, or any other types of deformity. Moving on to the neck, I'm going to have you flex. I'm going to have you practice flexion, so chin to chest, good, and extension, good. Next, what we're going to do is lateral rotation, and then lateral bending, good. So moving on to, from the neck to the scapula, anteriorly assessing, I don't see any bruising, deformities, swelling. I'm going to take a look posteriorly. They're evenly aligned, no muscle tremors or spasms, anything like that. Any tenderness? Any tenderness?
No.
Good. So moving on to flexion, I'm going to have you extend. Good. Extension, you're going to rotate backwards. Good. Moving on to internal, well, adduction, you're going to cross. Good. Abduction to the side and out. Good. Internal rotation, you're going to scratch your back almost. Good. And for external, I'm sorry, that was internal rotation. So external rotation, you're going to rotate out. Sorry, you're going to bend and then go up. Perfect. Excellent. So the scapula assessment was normal. Next, we're going to move on to the elbows. So flexion, extension, good. So moving on to internal so starting with supination, pronation, back to supination, good. So next for the wrists, we're going to have our palms facing up, flexion, good, extension, perfect, and then rotate internally, good, and externally, perfect. And then for the fingers, so flexion, extension, adduction, abduction, great. So next what I'm going to have you do is I'm going to do some special techniques. So I'm going to have you we'll do the wrist first. So I'm going to test your medial nerve. Any tenderness?
No.
Good. I'm going to do the Fallon test next. So you're going to put your arms together, perfect. Any numbness or tingling?
No.
Decreased sensation, perfect. So next what I'm going to do is check your rotator cuff. This is called Near's impingement. Good. And then the Hawkins test. Perfect. All are negative. Moving on to the spine. Take a look. So his shoulders are symmetrical bilaterally. They're an even height. He has a normal curvature of his back and no tenderness on palpation or other types of deformities, all within normal limits. So first I'm going to have you stand up. You're going to demonstrate flexion by bending and touching your toes. Excellent. Next, I'm going to have you extend by bending backwards as far as you can. Excellent. Next, what I'm going to have you do is rotate. Good. And you're going to bend laterally like you did earlier for the neck. Excellent. Perfect. So next, what I'm going to have you do is take a seat, and I'm going to have you lay flat on your back in the supine position to check your hips. So checking the hips. So flexion, I'm going to have you grab your knee and bend it towards you, perfect. Extension, I'm going to have you roll onto your belly briefly. And then bend your knee, bend your leg back. Good. You can roll back. Next, what I'm going to do is internal rotation. So we're going to bend your knee, So external rotation is inward, internal rotation is outward. Excellent. So next we're going to do adduction. Good. And abduction. Perfect. You can bend. So next I'm going to move on to checking your knees. I'm going to have you bend your knees so I can inspect and palpate. So we have a little bit of swelling here, but I can feel the normal hallows. So just a little bit of swelling, no tenderness or other deformities. Next, what I'm going to have you, so I already have you in the flexion position, so I'm going to have you extend. Perfect. So to test for internal rotation, I'm going to have you bend forward, towards the center, and external rotation, excellent. And then adduction would be bending, abduction out. Good. So I'm going to do a couple of tests now. So to check your meniscus, what I'm going to do is bend forward. Nope, so I'm going to have you just stay just like that, and I'm going to rotate in and extend. No clicking, so that's a negative sign, that's good. Next, what we're going to do is the varus valgus test, so it's a stress test. So what I'm going to do is apply pressure. Good. Good. Both are negative, and the next thing that I'm going to do is check the anterior posterior test, okay? Good. Good, both are negative. So next what we're going to do, so the hip and knee were both normal, so we're going to move on to the feet. So flexion, point your toes towards you, and then extend your feet. Good. Next you're going to rotate internally. Good. And externally. Perfect. And then I'm going to have you stand up and just walk for a second. Good. So you have a steady gait with both stages, the swing and the stance stage, no limping or other deformities. So that would conclude our musculoskeletal assessment. Thank you.